we're going to learn in this video, we're going to learn about the different measurements regarding morphine. Hello, my hospice family. Hello. Welcome back to Dunshospice. All right. My name is Dawn, and I am your extraordinary hospice nurse. In this video, we are going to talk about morphine, okay? And not just morphine, but I'm going to tell you exactly what you need to know regarding morphine. All right? Stay tuned. You don't want to miss this. My hospice family, how you guys doing in this holiday season? All right, I decided to wear red. Okay, I'm wearing red for you guys to get myself into the festive feelings. Okay, hello to all my caregivers. Hello, thank you to all of my new followers, my new subscribers for having subscribed to this hospice channel. All right, please, I'm going to ask you to please follow me on TikTok and also follow me on Instagram under Dunshospice. All right, Dunshospice. On TikTok, it's actually Dunshospice22. All right, Dunshospice22. But Instagram, it's just Dunshospice. And I'm going to put the link in the description bar. All right. So let's stay connected. Ask me questions, please. I want to hear from you. Now, we're going to talk about morphine. All right, and what you need to know, because this channel, my goal is to talk to you, my caregivers, is to talk to you and educate you regarding what you need to know as a caregiver to make the best decision for your loved ones. Do you find yourself being the caregiver of somebody with a terminal illness, somebody who's dying? Are you the wife? Are you the husband? Are you the daughter, the son, a friend, a cousin? Okay, if you find yourself taking care of a loved one with a terminal illness, of a loved one whose doctors say that there's nothing they can do, they have done all of the aggressive treatments, now the best thing to do is to go home and be comfortable. If that is you, okay, then this channel is for you. All right, and this topic is really going to help you. Your loved ones, the person you're taking care of. Now, has it come to the decision that he or she would be more comfortable under hospice care? And now he or she is having some symptoms. And then the hospice staff, the hospice nurse, or the doctor is saying that we should start dad on morphine. And you're kind of nervous. You don't know what to really think because you've heard a lot of misconceptions about morphine. All right, now this video is going to help you. Not only will this video help you, stay tuned till the whole video, but I also wrote a book. Okay, the book is in my description. Okay, it's called End of Life is Life, and it's also on Amazon. Please check it out, where I also go and talk about morphine. Now, that being said, I'm going to tell you what you need to know as a caregiver, what are the questions you need to ask. First of all, as you can see, I have my props, okay? I brought you a little syringe, all right? These are the syringes that we use when we are administering morphine, okay? And I want to show you guys this, all right? And I'm hoping that this will help you, all right? Do you see the numbers? As you can see, this is the syringe. Do you see the numbers 1 through, well, 0.1 all the way to 1, 0.1 to 1, okay? So regarding morphine, first of all, I want to say that morphine, it's not the morphine that's going to kill your loved ones. Administering morphine to your loved ones will not kill them. Because a lot of caregivers have that misconception. Maybe they've heard it from the movies, they've, heard it from a neighbor. As we all know, living here in America, the news, stories, it's always good to fact check. Do your own research, all right? And I want to make it clear that it's not the morphine that's killing or that would kill your loved ones. It's the disease, Morphine is not the enemy. It's the illness. That's the enemy. Okay? That's the enemy. Even if we never, ever were to administer morphine to your loved ones, according to the diagnosis, the doctors, your loved one will still die, regardless if they have morphine or not. I want us to be clear about that, okay? Because there's so many misconceptions. Because as a hospice nurse, I hear, oh, morphine killed my mom, morphine killed my dad. No, it was not morphine. It was the illness. Okay? It's the cancer. It's the end-stage COPD. It's the end-stage kidney failure. Okay? It's, the end-stage dementia. It's whatever the case is, That's what killed your loved ones. So please, let's make the distinction. All right. Now, that being said, morphine is here to help with the symptom. It's good for two things. And if you watch my previous videos, you will see that. It's good for difficulty breathing, and it's also good for pain, especially pain. Now, as a caregiver, I want you to listen very closely. What I want you to know is that when the nurse tells you that it's time to start your loved ones on morphine, okay? I want you to make sure that the nurse starts with the lowest dose, and usually they do. Now, if you guys could see this, okay, this is a little medication cap, all right? And it's up to the 10 ml, okay, 10 ml. And I'm sure we all have taken this before, okay? It's usually recommended 30 mLs for adults, okay? 10 mLs is for children. All right, this is what 10 ml looks like, okay? It's a range right here. It's 1 ml, okay? So basically, 10 of these syringes would equal this much fluid. Are we following? Okay. Now, I'm going to take 1 ml. I try to make it a different color so that we can see exactly what I'm talking about. But I don't think it's going to show up in the syringe that well. But I just filled it. I just filled it all the way in. Ooh, I have a little bubble here. Let's get rid of the bubble, okay? So we can make sure we are giving the patient the full dose. Okay, that's another thing with the caregivers out there. Make sure that you get rid of any bubbles, okay? When you're giving meds. Okay, so this is 1 ml, okay? And look how much I still have left. It's like nothing was taken out. This is 1. Okay, as you saw me, I just withdraw 1. Now, 1 ml. Now, with the hospice, we usually start the patient on 0.25, which is 5 milligrams, and it's going to be between the 2 and the 3. Okay, I'm going to put, you see, I'm going to look very carefully now. Look very carefully. I am putting mostly everything back. All right, there we go. Oh, it's still more. Gotta get rid of more. All right, I think we are at 0.25. Good. We are at 0.25 right now, okay? It's between the 2. Let me just put that down so you can see. We're at 0.25. It's between the 2 and the 3. Do you see it? It's between the 2 and the 3. Okay, there you go. Let me turn it around. Okay, we are at 0.25. This is how much we start your loved one on regarding morphine, okay? And we give this every 4 hours. That is usually the standing order. Like, we will do every 4 hours as needed. Some people might do every 2 to 4. Some doctors might say every 3 PRN or every 4 hours, but usually let's just go with every 4 hours, okay? This is how much your loved ones will be getting every 4 hours as needed of the morphine. Compared to, say, when we have a cough, this is the 10 ml. Compared to the 10 mLs right here, when our children, not even us, because for adults, as we all know, it's 30 mLs, right? But for children, we do 10 mLs, okay? And this is how much the nurse will be giving to your loved ones to begin. So the first that I want you to really pay attention. So what I really want to let you guys know is that, okay, if you are a caregiver out here, listen to me, listen to me. Make sure that the nurse starts very low. So that's what we usually do. We usually start very slow. Okay, so we will start at 5 milligrams and slowly. Okay, I have had some patients of mine who takes the whole vial, the 1 ml every 1 hour to keep comfortable. And even if you are taking the whole syringe every 10 hours to keep comfortable, it will be this much in your system. Now, that being said, this medication, morphine, it is a strong med. So that's why we usually go slowly, because we want to monitor you. We want to monitor your signs and symptoms, monitor your body to see how your body is reacting to the morphine. So my beautiful hospice family, I am showing you this because I want you to know that, please, we are breaking loose, okay? From now on, all right, come to Dunshospice. We are going to break loose from any spirit of fear, any spirit of anxiety when it comes to morphine. Because the more education we have, the more well-informed we are, the less anxious, the better we're going to be able to make an informed decision. So when the nurse says, okay, or when the doctor says it's time to administer morphine, make sure that they are starting low, okay? If a nurse comes in to your home and then say, okay, we're going to give dad 1 ml or 20 milligrams. So 1 ml is equals to 20 milligrams. 20 milligrams or the full syringe. Say no. Say no. Let's start that off at 5 milligrams, okay? Which, as I told you, is a little bit. Now, if that works, if dad could tolerate the 5 milligrams, okay, and then dad is still having symptoms, all right, then we will say to put it in the 5 milligrams. So the 10 milligrams, which is going to be the 0.5 ml. Okay, the 0.5 ml. See, I want you guys to be able to see it good. Okay, it's at the 0.5. Okay, so 0.1, 0.2, 0.3, 0.4, 0.5, all the way to 1. All right. Okay, guys. So this would be half of the syringe. Yes, my hospice family, please let me know if you have any questions, if you have any comments. What are your experiences with regards to administering medications, administering morphine to your loved ones who's dying? And I want you guys to also know that usually the hospice nurse will leave the morphine. Well, this is not morphine, but we'll leave it. This is actually just my cleaning detergent. I just put my cleaning detergent so I could show you guys. Hospice nurses, we are not allowed to carry medications with us. Nope, we're not. So yes, my hospice family, usually we will lock up these medications, because if you have little children in the house, grandchildren, or sometimes too, we might have family members who are addicts. So we will lock these medications in a lockbox, and only few people, including the hospice nurse, will have the code to the lockbox. Okay. Let me know what other questions you have regarding morphine. But I just wanted to just come out here briefly and just demonstrate to you that when we are administering morphine, we start very low and then gradually we will increase. And that also to let you know that it's not morphine that's killing your loved ones. Rather, it's a disease. If anything, morphine is here to help with the symptoms of end of life. Regarding pain, it will help to, make you more comfortable. Regarding shortness of breath, breathing, it will help you with all of those things. Okay, my husband's family. Let me know your thoughts. Please share this video. Subscribe, follow me. All right, let's start this beautiful relationship. I love you as always with the love of Jesus Christ. I will see you in the next video. All right.